Doctors in South Korea are trading in their gowns for candle lights. Emotions run high at this rally against a government plan to overhaul the nation's healthcare system. Medical professionals say the plan will do more harm than good, and the government is more concerned about political theater than public health.
일방적으로 의사들을 어린 전공의와 의대생들을 범죄자 취급하며 이렇게 망국적 정책을 추진하면 윤석열 대통령은 역사에 실패한 대통령이 될 것입니다.
At the heart of the controversy is the government's decision to add up to 2,000 medical school students annually. Officials say more medical professionals are needed to make up for a shortage in essential fields like pediatrics and obstetrics. But doctors argue simply increasing numbers won't improve access to quality health care. Rather, uneven compensation and a system that overworks doctors must be addressed first. Otherwise, they say med students will continue to gravitate to more lucrative fields like cosmetic surgery and dermatology. Regional disparities in access to health care are another concern for medical professionals. Many of South Korea's medical resources are concentrated here in the capital of Seoul. In fact, many patients prefer to receive treatment at large prestigious hospitals like this one behind me. The result is many regional and rural hospitals and clinics are underutilized and struggle to attract and retain qualified staff. Pa Gung-soo was diagnosed with lymphoma in 2022. When the first two local hospitals she visited were unable to treat her, she was fortunate enough to be admitted to one of the so-called Big Five hospitals in Seoul. She continues to receive anti-cancer treatment by some of Korea's finest medical care.
간호사 선생님들도 그렇고, 전공 선생님들도 그렇고, 교수님도 그렇고 그렇게 나쁘게 하고 한 적은 없었어요. 저는 다른 사람은 어떤지 몰라도 지금 장 터져가지고 중환자실에도 갔다 온 사람이고.
Other patients aren't as sympathetic to the striking doctors.
나도 치료받는 입장인데 나도 당장 의사가 없어요. 그럼 내가 누구한테 치료받습니까? 나도 지금 혈액암으로 돼 있는데 그래 그거를 조금 반만 양보해 정부에서 지금 양보 많이 하잖아요.
Past administrations in South Korea have tried and failed to enact similar healthcare reform measures. But President Yoon Suk-yeol appears determined to push through with his reform plan. A former prosecutor, President Yoon has built a reputation as an uncompromising hardliner. But his first 2 years in office have been mired in low approval ratings and scandal. That's why some question the timing of the government's reform plan.
그게 의사 수가 부족하다라는 논리와 그다음에 의사들이 돈을 위해서 그 자리를 떠났다라는 논리로 의사들을 흔히 악마화라고 하잖아요. 의사들에 대한 나쁜 이미지를 심어줌으로써 자신의 주장이 정당하다라고.
Mi-sun Kim is an associate professor of political science at the University of Texas Rio Grande Valley. She believes the timing of the South Korean government's announcement wasn't a coincidence.
This is a perfect example of a populist agenda, right? Creating a certain enemy, and then, by doing so, describing us and them, and here in this case, them, doctors, the privileged group in South Korea, and us, the vast majority of the population. And so it is very easy and smart choice, electorally speaking, to create that kind of world.
Many polls suggest South Koreans are generally in favor of the government-proposed plan. But as the stalemate drags on, the public is beginning to grow weary.
And actually, lots of polls show that the population in general, they support the government motivation. But of course, how this thing has been handled so far is kind of frustrating. So public opinion is now more torn.
Voters in South Korea dealt President Yoon's party a crushing defeat in parliamentary elections back in April. And soon thereafter, his approval ratings dipped to all-time lows.
Compared to his predecessors, for example, Park Geun-hye from his own party, right? Even though she was faced with more serious issues, but throughout her tenure before her impeachment, her approval rating was always higher than his. So this means that Yoon is in a serious situation.
In trying to reach a consensus, the government has offered to scale back the original proposal of 2,000 additional medical school seats. But doctors want the government to scrap the entire proposal and negotiate from a blank slate. In the meantime, more than 10,000 trainee doctors remain off the job with no return in sight, while other medical groups weigh other collective measures.
정부는 총파업과 전체 휴진이 현실화되지 않도록 마지막까지 의료계를 설득하는 한편 의료 공백 최소화에 모든 전력을 쏟겠습니다. 의료계는 부디 국민과 환자의 호소에 귀를 기울여 현명한 판단을 내려주십시오.
It's clear that both the government and striking doctors will have to make concessions to reach any sort of compromise. The worry, though, is that trust between the two sides is dwindling. And in the end, it's the patients that will ultimately suffer. Hahm, CGTN, Seoul.